Everyone. We're here to talk about this article about parents' views on care for their very premature babies in neonatal intensive care units, which is a qualitative study. The paper explores the parents' views and experiences of the care for their premature babies in a neonatal intensive care unit. The study helps to provide more research and evidence to back up the previous findings to drive forward more funding and resources to improve the quality of care given to the parents and the premature babies. This topic is relevant as premature birth is such an important determinant of adverse outcomes within emotional and psychological impact, as well as quality of life and in terms of survival. Having a premature baby and having a longer hospitalization in the NICU are often associated with a lot of psychological and emotional stress, even can be seen as a traumatic experience by the parents. With the information that has been gathered in this paper, they may be able to assist healthcare workers to better improve their services to the parents and the babies. So as I said earlier, this is a qualitative study designed with a focus on in-depth interviews, which are conducted by a professional who has done these kind of interviews before. They are with 12 open-ended questions, and the interviews last for 45 minutes. They have recruited their parents from 3 different care centers in Southeast England. And when the interviews were done, they were of course recorded and they were transcribed and then analyzed by thematic analysis. Some of the strengths of the study is that it is an open-ended question and an in-depth interview, as the interviewer can then choose how they can be more fluid in their choices of how to, and can choose how to direct the different questions and where to lead the study onwards. Some of the negatives, though, are that as the interviewer is one of the research people on the paper, he might be a bias, and it can be hard to stay objective on this. It's hard then for him to stay objective.
For sampling, the study used propositive sampling method to select participants with relevant experience into research topic. Participants were parents who satisfied sample criteria selection. Participants were recruited through letter invitation or poster in neonatal unit from 3 tertiary care centers in Southeast England. The propositive sampling provides some strengths, include allowing researchers to select participants with characteristics relevant to study, and also it is more efficient than random sampling, especially in qualitative research, emphasizing the depth of the topic. However, there are some limitations, such as sampling bias related to English speaking participants and selection bias related to representation of certain group, but seems multiple sample recruitment were conducted to mitigate this issue. In terms of data collection, it includes interviews, questionnaires, and medical records. Collecting data through multiple ways can provide comprehensive understanding of the study and will enhance its validity. Interview conducted by experienced psychologists and all records. The strength of data collection include the use of various data sources, experienced interviewer, standardized question, while the limitation are recall bias related to long interval of interview, social desirable bias related to invitation letter from NICU so that the parent may give positive response to the care. And since this is sensitive topic, so the parents may give some common answer during interview.
This article used an inductive thematic analysis to analyse the results of the study. Thematic analysis really offers an accessible and theoretically flexible as well as systematic approach to analysing qualitative data. It analysed transcripts and then read and then reread those transcripts to produce some codes that were relevant. They then used an NV-IVO version 10 software to analyse those initial codes and themes. The strengths of this analysis were that it was quite relevant to the qualitative data analysis, and that the software created quite an efficient way to analyse that data. The limitations were that there were potential for researcher bias, as there were many steps involved in the analysis of the data. The findings that came from this paper were that there were three main findings: parents' involvement, staff competency, and then interpersonal relationships with staff. The strengths of the study were that they provided really in-depth insight into the experiences of parents of preterm babies in the NICU. The limitations, although, were that these results can't be generalised for all parents, and they largely reviewed white, educated and married parents in the southeast of England. There were also many steps involved in the process, and so there were potential for many biases to occur. The application can be applied to quite a few instances in different NICU settings, so we thought it was quite a good study to providing the attention and the research towards this topic.